Hi, Nikhil Som. My name is Dr. Eric Lee. I'm a hematologist and medical oncologist at Los Angeles Cancer Network. I practice in Fountain Valley and Los Alamitos in Orange County, and I'm very happy to answer your questions tonight.
Thank you so much for joining, Dr. Lee. We really appreciate it. What originality drew you to medicine and what led you into your specialty?
Growing up, I actually had several family members who were diagnosed with cancer, and some of them were diagnosed with cancer at different points of my when I was young and when I was, going through school. Had a grandfather with stomach cancer, I believe. We think it was stomach cancer, and he was diagnosed when I was in the fourth grade, and he had surgery and really struggled through it. That was back in the day when I'm not sure there was even real any good chemotherapy for it. Um, and we had thought he was in remission. He actually struggled after his surgery. It took him a long time to recover, probably over a year. Between Thanksgiving and Christmas, he went, "Uh-oh, something isn't right." And that's when, went back to follow up with his oncologist and found out that his cancer had metastasized. And at that time, there were not very many good treatments. We had no genetic and molecular testing. We didn't have any of that. And so effectively, he went on hospice during that time. And then when I was transitioning between college and graduate school, no, it was right before I went off to graduate school. My other grandfather was diagnosed with metastatic prostate cancer. He did receive some treatment, but again, that was a time when we didn't have a lot, and and I felt that he deteriorated rather quickly, and I actually did not feel his pain was particularly well controlled. And I remember I thought to myself, how can isn't there something in the middle? Why can't a doctor like find a way to get his pain controlled and still have him be lucid? So he can like we can watch a football game together or something like that. But it seemed like it was either one way or the other. There was no in between. And for the longest time, I thought there was no in between. But now I do it for a living. This is what I do. And there isn't in between. If you spend enough time with the patient, you spend enough time with the family, you can get people into that happy medium and get things under control and give them their quality of life. So that's kind of what led me into medicine and led me into oncology. It's a family experience with it. Um, but my route into medicine was rather circular. I remember when I was almost done with college, I applied to medical schools, and and I didn't know anything about an MD PhD program at that time. So I applied to a few, thinking to myself, oh, there's like, I don't know, 15,000 doctors graduate every year, and maybe only like a few hundred MD PhDs. It's very difficult to get into. So I applied for it thinking, there's no chance I can get into it. And completely by surprise, I got accepted into a medical scholars program where you do an MD and a PhD. And I ended up studying physics and biophysics. So I ended up with a PhD in biophysics. And then I finished my medical school and actually stayed on as faculty for a little bit. So I taught students, and when people asked me what I did, it was almost like what Dr. Sheldon Cooper does on Big Bang Theory. I was a theoretical physicist, actually, before I became a clinical doctor. So I actually had a different life. This is really my second career almost. And so I kind of had a different route than a lot of people. And I don't, and I thought it was wonderful because I got to experience just about everything. The path towards becoming a physician or whatever you become later on is not a straight path. It could be a circular path. You might have some detours, and that's okay because it makes you a better person. It makes you a more well-rounded person, and it teaches you new things and it gives you more perspective.
Yeah. Honestly, I think that's one of the most unique and um like significant answers that we heard. I think um not many people talk about like how important like that personal story is to becoming a doctor, and I think it's really cool that you essentially had two careers and two really hard ones kind of packed into one life. I think that's really unique and that's really great. What does a typical day for you look like in oncology?
So in general, I have a clinic. I see patients in the clinic. But in our clinic, we also have an infusion center. So patients come in for their treatments. Some of them come in for cancer treatments. Some of them come in for other types of monoclonal antibodies and targeted therapies that may not be related to cancer at all. Some patients with inflammatory conditions, we give medications to help those conditions um, uh, to help other doctors actually. Some doctors would actually ask us to give these therapies to their patients to treat non-cancerous conditions because we just happen to give a lot of those medications for cancer as well. And so typical day for me is taking care of patients. I also take care of patients on clinical trials. I spend part of my day in meetings, not just talking to the clinical trial teams, but also meeting with like sponsors that um, might be interested in bringing us a clinical trial to help our patients out. So we try to find a good fit for that. I like to be prepared when I see the patients, so I review everything before I walk in the room. But sometimes I encounter a new piece of information, and then the plan completely pivots, right? And so that's kind of a typical day. We spend a lot of time taking care of patients, and we get a lot of phone calls from patients, coordination of care. Spend a lot of time talking to specialists, other doctors that might refer patients to us. But it's one man is not an island, right? We work together in teams. And so sometimes I may need help from a surgeon, or sometimes I may need help from a different specialist to co-manage some of the side effects of some of the treatments that we give. And so it really is a big team effort. We also work with nurse practitioners, the nurses in the clinic that help give the therapies. We have medical assistants that help take care of the patients, give injections. So that's kind of a typical day. It's pretty much nonstop. I think that our interactions with other people is the most important part of medicine. In medical school, everybody is smart. You're going to learn all about everything about the human body, about every single disease, and you're going to learn how to solve problems. But the one thing that they don't teach you in medical school is interacting with people, right? So part of the medical school curriculum as medical students, you follow other doctors around, but you also spend time talking to patients. And I think that's probably the most important part of medicine that we don't get a lot of training in, but in the real world is so important. Sometimes it's not the patients want you to help them solve a problem, but you have to be able to communicate with them in a way that communicates on their level. So even though you might have 10 things you want to tell them, you might only have enough time to tell them three things because you spent the other time listening to the three things they told you. And and when I first started in medical school and as a resident, I used to think I'm walking in a room with the knowledge and I need to tell it to the patient and I need to get my point across so that they can follow my directions and get better. That's wrong. Patients will not listen to you unless you can connect with them, and they have to feel like you listen to them. They have to feel like you have their best interests at heart. And so I think the ability to listen is just as important as the ability to communicate, because listening is part of communication. So the best part of my day is basically seeing the relationship that gets built when I get to take care of a patient for a very long time. Okay, it's fun to solve problems. It's fun to see people get better. But I think the best part is the relationship with the patients, and a lot of it is silent. It's quite wonderful.
A lot of people just know about a doctor as just making diagnoses and telling the patient, but I think it's really cool that you highlighted that like those tiny moments with the patient, like those little moments is what really makes the day, and it's really important to you guys. Did you ever feel burnt out of your specialty, especially emotionally? And if so, how did you move past it?
I think that the feeling of burnout comes more maybe from the emotional weight of taking care of the patients more than the medical decision making. I think the medical decision making comes, it's not difficult. I think that, I kind of know what to do before I walk in the room. But the difficult part is making it happen. Just because you have a plan does not mean you can make it happen for the patient. Patients face a lot of barriers to care. Some of them don't have family. Some of them don't have resources. They don't have transportation. There might be a language barrier. There might be preconceived notions of healthcare and bias. Some people are distrustful of doctors. And I think every doctor will tell you this. You have to kind of convince yourself that you didn't fail if you couldn't convince the patient to do something, because patients, they have a right to say no. Um, but we always want them to kind of make a decision that might be better for them. But they're also their own human being. So I think that if you ask me, do I feel burnt out? I don't feel burnt out of like being a doctor and practicing medicine. That's wonderful. And being able to help people every day. That's wonderful. I think that the burnout is where you feel like you could have done more, maybe. Okay. And I think we all feel that way.
What advice would you give to high school students that are also interested in medicine?
The question is, how do you know what you want to do later on if you don't know it right now, right? I think that it's okay not to know. I think that sometimes you can always change your mind. I think this is one thing that I learned from one of my fellowship mentors. And this happens in the real world as well. Because I told him, I said, when I finish fellowship and now I'm attending and I'm practicing medicine, I said, the biggest difference is um, once you make a decision for a patient, it's final. No one looks over your shoulder. You don't have a boss that tells you that's the wrong decision. And he looked at me, it's like, you can always change your mind. And I said, what do you mean? And he says, you can change your mind. You can change the plan. You can make a different recommendation. And I said, no, you're right. So I think it's important to see a lot of different things. I think that oftentimes the path that we end up on is not the path that we envisioned on in the beginning. And that's okay, right? A lot of, famous and accomplished people did not really do what they were famous and accomplished for until they were much older, right? A lot of famous authors, a lot of, other things their life achievement didn't happen when they were young. It happened when they were much older. But they did a lot of different things when they were young that led to the thing later on. It made them a more well-rounded and whole person. So I don't think you have to know what you want to do later, right now. Okay. And nor do I think that you have to say, I absolutely have to become a physician. There's so many things to do. As people get older, the thing that they run out of is time. So now for young people, you have a lot of time. You also have a lot of time to kind of explore and do a lot of different things and meet a lot of different people and to kind of see what makes them happy, right? Because your version of what makes you happy in the future will be a combination of everything that you've seen. And it'll be different than any one person that you've met. So I think that the best advice I would give to students who are starting off and don't really know what they want to do is be open to do just about anything and meet a lot of people, ask a lot of questions. And when given an opportunity to do something that you're kind of uncomfortable with, as long as it's not physically dangerous or hurts anybody else, say yes, try it out, right? What's the worst that can happen? So that's probably my advice. I think that it's important to go a lot of places and see a lot of things.
Yeah, I think it's really important to do that because I know a lot of people sometimes, for example, like maybe someone is pressuring them to do something or they're doing something just for maybe something that they may not genuinely want. And I think it's really important that you highlighted that like we should really just try and explore everything and keep an open mind, especially nowadays that we have so many choices and what we can do and what we can do with our lives. I think what you said is really important and that not only one thing should be considered as what
Mhm.
you can do when you grow up. So I think
There is a you can debate me on this, but I do think that the most successful people have a quality called grit. And grit is the ability to persevere through a difficult situation at some degree of personal sacrifice, to understand that there's some form of like deferred reward um, by investing something now so that things will be better later on. it's difficult. The younger you are, the more difficult it is to imagine that. The older people get, they'll be like, yeah, that's probably true. And when they look back, they'll probably think to themselves, oh yeah, I there were times in my life where what I did would have been considered, an action or a set of activities with a lot of grit. There's a certain perseverance in people who really, really set a goal and they really, really enjoy what they're doing. And despite failure after failure, will keep on pushing forward. And eventually, you'll accomplish it, right? If the goal is worth it, you'll eventually get there, right? Every worthwhile task is at first impossible, right? Until it's not. And when you look back, you thought to yourself, I thought that it was impossible. I thought it was the most difficult thing ever.
And I think becoming a doctor in some ways like is kind of really just a measure of how much grit you have, because I think it's a long-term investment, of course, with the amount of training. But I think in the end, if you really love it, and I think if you have a really genuine passion for it, I think it's something so rewarding that like no other thing can really replace the amount of the amount of joy you get from it. So I think
That's my best advice for young people. I think there's worth in just about everything. And everything's a trade-off, right? It's a 24-hour job. The patient need your help, you jump to action, right?
what are some of like the most common simple cases you see on a daily basis? Of course, there's no like not really super simple
Mm.
cases in your field, but
The best common simple case is obviously somebody that's, that you've helped to get into remission. They're not sick anymore. And you're basically, you see that they're now living their lives, right? And instead of spending time talking about lab tests or scans or whatever, they basically spend time during the visit telling you about what they had for lunch that day, or what vacation they went on, or something they're very proud of in their family.
I think that's really the most rewarding part of being a doctor, really. I mean, seeing people you've helped for so many years, just being able to live life on their own without any harms, you know? That's really the best part. Thank you so much, Dr. Lee, for interviewing. We really appreciate it.
thank you so
So
much, Rishi.
I'm very happy to help moving forward. Just let me know what you guys need.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.